We are united in diversity. We are very heterogeneous in our opinion.
If we do not renew our partnerships with the rest of the world, Europe will not be relevant.
We can make it if we are together as Europeans.
And looking ahead to what is next.
Do you genuinely believe that countries will manage to reach these very ambitious targets?
Hello and very welcome to our next session. My name is Giedrė Peseckytė. I'm health reporter here at POLITICO. And I hope that during the session that is called Towards More Sustainable EU Healthcare Systems, we will get a chance to discuss what we need to do to make sure that our healthcare systems are prepared for the challenges of today and of tomorrow. I'm talking about aging populations, I'm talking about climate crisis, I'm talking about wars, pandemics, and natural disasters. So we cannot touch all of these aspects because it's a lot. However, I will have a great panel of speakers which will help to dive into a few topics that I want to focus on. It's how to ensure that healthcare systems are two things, not understaffed and not underinvested. So before we start, we have an opening remarks from Gabriele Grom, Market Sharp and Dome Public Policy Executive Director for the Mid-Europe region. Right afterwards, we will start our discussion. So, Gabriele, the floor is yours.
Good morning, ladies and gentlemen, distinguished guests. It's an honor for me today to open this very, very important panel discussions on towards more sustainable EU healthcare systems. So over the last decade, the EU economy has experienced very slow growth, and it is not expected to grow substantially in the coming years. Since the pandemic, we are facing with the current perma-crisis encompassing geopolitical and climate-related challenges. Fiscal sustainability is threatened through slower economic growth, followed by increased government deficits and consequently also higher public debt levels. The demographic development is increasing pressure on public finances, particularly in healthcare and social expenditures. So the aging of the European population alone, regardless of all other crises and urgencies we have, creates a burning platform and has major impact on national healthcare systems and welfare systems, both in terms of financing as well as in terms of demand for healthcare services. On one hand, the gradual decrease in the working age population with the same employment rate will lead to a gradual reduction in the tax revenues needed to finance it, and also on the other hand, the increase in the elderly population will lead to a growing demand for health and social care, putting further pressures on healthcare systems that already today struggle to guarantee fast access to services for the entire population. So healthcare expenditures per capita in the over 65 population is above 5 times as high as in the population below 65 years. So addressing these intertwined challenges is essential to ensure the long-term sustainability of healthcare, social care, and the welfare systems across the European Union. In this context, there is a need for a new paradigm that shifts the healthcare model from a reactive, treating sickness to a proactive system, promoting health, leveraging investments in health prevention. At this critical juncture, the EU has introduced a new economic government framework, which provides an opportunity to consider investments in the healthcare system, especially in prevention, as social security investments, similar to what has been done for investments in defense and the digital and green transitions. So this is for the first time that healthcare expenditure is recognized as a strategic investment, not as a cost. Prioritization of health has the potential to be a societal and economic game changer to support future prosperity, well-being, reduction of inequity. Studies show that for each dollar invested in improving health, an economic return of $2 to $4 is possible. But let me illustrate you one opportunity which could be considered as a low-hanging fruit. There is an extensive literature discussing the potential advantages of preventive healthcare, like promotion of healthy lifestyle, screening programs, and particularly immunization strategies. So preventive healthcare not only translates into increased life expectancy and improved quality of life, but it also yields economic advantages such as savings in healthcare spending and increased worker productivity, thereby supporting the economic of countries and social growth and resilience. The containment of public spending frees up resources that could be dedicated to improving the equal availability of healthcare, improving quality of services provided, and also leveraging the value of innovations for prevention, diagnosis, and treatments. So these studies suggest that every €1 spent on preventive healthcare generates a 14 euros return to the health and social care economy. Regarding immunization, a recent report has shown that adult immunization returns 19 times its initial investment to the society and economy, and up to 33 times in the case of pneumococcal immunization. So, however, looking at the situation today, only a small percentage of national healthcare budgets is spent on prevention, and even less on immunization, only 0.5%. As these studies show, through a higher focus on prevention, European countries can mitigate the future burden on their healthcare and welfare systems and promote long-term economic and social resilience. In the future, spending on preventive healthcare can be considered an investment, as it entails potentially higher growth and reduces future expenditure. So it's really imperative to recognize that the current perma-crisis needs to be addressed and overcome with concrete solutions. And in this context, embedding preventive healthcare and particularly immunization into EU members' fiscal strategies is paramount to promote the economic sustainability of healthcare, social care, and welfare systems, enabling them to adapt and flourish amidst the challenging and unpredictable conditions Europe is currently facing. To conclude my opening remarks before leaving the floor to our distinguished panelists, I want to emphasize again that the challenges are really significant and they call for a strong stakeholder collaboration. We all want that all citizens and future generations have equal access to health care, treatments, and immunization. We thrive to maintain and to improve, especially in areas of unmet medical need, that the medical standard of care increases. Let's move forward together and do not accept any steps backwards. Thank you very much.
So here we are back again. I would love to thank Gabriele Grom. I think this sets the scene perfectly for our further discussion on the topic. And here with me, I have my distinguished speakers. So we have Aurimas Pečkauskas, Minister of Lithuania of Health, Martin Balzan, Vice President, Standing Committee of European Doctors, Simon Brassel, Senior Principal Economist at Office of Health Economics, Caroline Costongs, Director at EuroHealthNet, and also Francesca Colombo, Head of the Health Division Organization for Economic Cooperation and Development. So, as I mentioned in the beginning, there are a lot of challenges that healthcare systems are faced now. So, I would love to hear from each of you. What are the main challenges that you want to highlight in this discussion? And I would ask you not to dive too deep into this because we have still 15 minutes, but just briefly touch on them. So if I could start from the minister, because you know what's happening on the ground. So could you just tell us how Lithuanian health system is ready for the health crisis and actually the challenges of today and of tomorrow?
Thank you very much, Giedrė, and hello everyone, and thank you, Politico, for inviting me here. So I'll try not to dive too deep in that sense, but well, I currently, back in Lithuania, and what I see in the European level, I think there are two major problems which must be addressed. So first of all, it's workforce crisis. And interestingly enough, WHO talks a lot about it. Every country has a lot of problems with that, or are forecasting problems in the near future together with demographics and aging population. But unfortunately, at EU level, we do not talk enough about this, and I think this is one of the major topics we must face in near future. And another one is preparedness for the challenges, the future challenges. We talk a lot about the preparedness for future pandemics. We talk about preparedness for the same aging population. But I think what is lacking in the general discussion is also talking about the preparedness of healthcare systems in geopolitical scene. And especially for me, who lives in a small country on the eastern border of EU, and I can say pretty surely together with Finland, Latvia, Estonia, and Poland, we share this problem for our healthcare systems to be prepared for the war challenges, what we see in Ukraine. So I think these two topics should be one of the most important in the near future.
Thank you for sharing those. Francesca Colombo.
Well, very much agree. I mean, we published actually a report on the resilience of health systems reflecting on the COVID-19, and we said something that you said at the beginning. Health systems are underprepared, they're underfunded, and they're understaffed. So very much agree. The health workforce is one of the biggest challenges that we are facing. But the underfinancing, it's also a particularly important one because not only we know that we need to invest more in health system, but the financial sustainability of health system is a big question mark at the moment. And where we find the resources to sustain the investment of the future, it's a particular difficult and daunting challenge in a context in which revenues are going down, competing priorities are there, and the growth of the economy is just sluggish. So there is a mismatch between what the demand and the needs on the one hand and our ability to pay and finance it.
Mm-hmm. Thank you. Caroline Costongs, EuroHealthNet members, the partnership, cover nearly all Europe. So what do you see, what do you hear from partners, and what also you would like to highlight on this topic?
Yes, thanks a lot for this. Well, I think one of the most painful issues for us is that still there are huge health inequalities in member states. Somehow health systems are not capable to provide health for everyone, and this is unjust and unfair. And this is not only about inequities in access, which are clearly there because there are increased unmet medical needs in several countries, but it is very much also factors across society that health systems need to better attend and monitor and reach out to in order to accommodate those. Secondly, what's also painful for us after decades of working is that still you can see that only about 2 to 3% of national healthcare budgets goes to health promotion and disease prevention, while we know that NCDs are increasing and about 80% of NCDs are preventable. And there is a lot of talk also today, as we have seen throughout the previous years. Everyone agree we need to invest in prevention. Everyone says yes, you know, it's an open door, but just not being done. We had after COVID, of course, we have seen the tenfold increase in the EU for Health program. We've seen some more investment, but now we risk that this investment is going to be downscaled, and we see already cuts in this in some member states. And well, I'll leave it here, but these are my two
We will
big
dive
worries.
into this deeper later on. Simon Brassel, what would you highlight?
Thank you very much, yes, and also thank you for the invitation. I do think one of the things that I want to highlight is the disconnect between how we value prevention and actually how we then fund it. We know a lot about the value of prevention, and that includes public health, that includes immunization. and so on. And we know that this is roughly 3 to 4 times more cost-effective than treatment. So actually, we can generate a unit of health much cheaper than with prevention than actually with treatment. We know that it's good value for money. We were one of the authors of the OHE report on the value of immunization. Adult immunization returns 19 times up their value in society. Prevention 14 has a benefit-cost ratio of 14 to 1. So quite a lot. So my question then would be, why is that not reflected in actually the immunization budgets? Because all countries actually underfund when we think about the share that goes of healthcare budgets into immunization. And I think this is a disconnect that we have to address by accepting that investment in prevention generates a lot of spillover effects in other parts of the economy or other sectors. And the second of all, we also have to really think about how we can enable long-termism, long-term thinking, and not just basically solve short-term problems.
Thank you so much. So last but not least, Martin Balzan, from your perspective, what will be the main aspects to highlight shortly?
So demand for health services is going up, mostly because of increasing age, but increasing age comes with increasing dependency and disability. So the healthcare system has to keep up, and to keep up, you need planning. Now, the healthcare system has 3 components, basically: the workforce, the infrastructures, and 3 equipment, consumables, and medicines. For all 3, you need money, you need planning. Now, focusing on health workforce, unfortunately, there's no quick fix, because to train a doctor, it takes 6 years. To specialize, it takes him 4 to 6 years. We are against shortcuts. We don't want to compromise on the quality of the medical service. Some people have proposed shortcuts. We disagree. The other thing is that with long-term planning, every country should plan to have enough doctors, based not only on the current demand, but on the lag and the projected demand. Now, to have more doctors, you need to make the profession attractive to young people.
Okay, we will dive in this in a second then. And actually, I would like to again bring Lithuanian health minister because I myself from Lithuania have to disclose this fact, and I have at least few friends who left to work in Switzerland. They were trained as doctors. After many years of training that Lithuania paid, they leave. And I know that there are a lot of other stories like this. So we just heard Martin Balzan saying, how important that countries prepare their health workforce. So it seems that Lithuania is preparing the workforce, but then they are losing the workforce that they prepared. Could you share what is happening in your country and how are you trying to keep the talent in the country?
That's a difficult and wide question, so I can talk non-stop for a few hours about this, but I will try to do it in a nutshell. Well, generally, the bigger problem in Lithuania we have when talking about nurses and other healthcare professionals, but also the problem is rising with the doctors as well. If we look at the numbers, Lithuania has quite a high number of doctors per 1,000 or 10,000 inhabitants. But problem number one with that number is accuracy of the data which is being given. And another bit is that our system, like a healthcare system, is not so efficient. We are not using our doctors so efficiently as we would like. And keywords here is bureaucracy, hospital network, a lot of in-hospital beds, and so on and so on. So this is the one problem when talking with the doctors. And we actually are preparing quite a lot of students. The quality is quite good, and then of course we are improving in that area, especially in postgraduate training. We recently changed the legislation in that sense. But the problem is that bigger countries come to Lithuania and proactively tries to retract medical workforce to the bigger countries. Of course, there are a lot of talking in that sense, but for example, we see, Denmark, for example, Germany, Norway, Sweden, and other countries having cooperations with our universities or other higher education schools, and we have these proactive measures being taken, and it is really not fair from our perspective. So, and I'm going to the second point I want to make, because, well, we know what we need to do, what every country needs to do. Train and retain, right? Plan, forecast, build the capacities, continuous professional development, and so on, to attract, to keep the workforce in the country. But it is nothing if every single country makes these measures by itself. So, for example, if Lithuania, with their quite tiny economy, with possibilities which is not huge, we start to increase the preparation of the doctors, the preparation of the nurses, and other countries do not do the same in the same sense. We still are in the position where someone comes, proactively takes our doctors. For example, one more bit, we have quite good forecast, and in 10 years' time, we will have a huge shortage of nurses. We are talking, if we want to reach up to that shortage, we need to double the numbers of nursing staff we are preparing, and it is not really possible, and especially when you are trying to, put a bucket of water on the fire, and that bucket has a lot of holes in there. So it is my stance on
thank you so much for sharing that. And those who were following the previous discussion probably heard how passionately a member of the European Parliament, Andriukaitis, was saying that we need to stop this recruitment, talking specifically about Western countries getting the healthcare stuff from Eastern countries in this case. So, Mr. Balzan, I'm sure this sounds not like news for you. It's not the first time you're hearing these stories. But what could be done here? How to ensure that healthcare staff stays?
So we have this slogan: more, happier, more, better, and happier. When, at least in Malta, we had asked the doctors why they are leaving. Part of it is the money, part of it is the quality of the training, but a big part of it is the professional satisfaction. That means what you have studied and what you have learned. So the working environment where you feel respected, where you have opportunities for career progression, where there is no violence, there is no threat. If you have psychological problems, you are supported. So if you are happy on the job, you are more likely to stay in the country. But remuneration, money, is part of the reason. I'm not hiding. Now, the position of the Standing Committee on Migration, we are against coercion of doctors to stay into their country. So doctors must be left free. We are more in favor of countries creating incentives for doctors to stay in their own country. Malta would be a good example. So we have now one of the highest number of doctors, but when I started 20 years ago, we were the lowest. And in this room, there's the director of postgraduate training, and he might confirm what I'm saying. So if the doctor is happy, he will stay. We disagree with coercing doctors to stay into the country, make them sign contracts that if they leave the country, they have to pay so much money back. This is against our policy. So we are in favor of keeping the doctor happy. That's good for the patient, because the doctor is practicing his profession as he likes his job.
Thank you. Thank you for sharing that. And on keeping doctors happy, I saw OECD's report on health systems resilience, and it comes with recommendation to promote workforce retention and recruitment. So I would like to bring Francesca Colombo here. We're so happy to have you from OECD to share how actually, with rising burnout and workforce shortages, what measures could we introduce to support healthcare professionals and retain the talent?
Absolutely. Retaining the health professional is fundamental. It's about the quality of jobs. Then I would say that, however, just retaining the staff is not enough, and we'll elaborate more on that. So we have seen during the pandemic burnout from health professionals. We have seen people leaving more from the nurses and the care workers rather than the doctors per se. But there is an issue of attractiveness of the medical profession, and we see that in students as well. We have released Health at a Glance Europe yesterday and discussed also some of the issues about what are the aspirations for the 15 years olds that is looking at some of the data that come from the PISA study that looks at the numeracies and literacies of 15 years old, but also ask what jobs do you want to do into the future? And this is a survey which has been done over time. We see a decrease in the attractiveness of the healthcare sector as a sector of choice for 15 years old, particularly when it comes to nurses, when it comes to care doctors, a little bit better the situation for doctors. But still, so we need to do something to make the attractiveness of the healthcare professions something that the young people think of as a career choice. So that's, it starts from there. Then obviously it has to do with the quality of the job, so obviously not just the pay, but also the working conditions, the burnouts, making sure that the mental health professionals are taken care of and so forth. However, I do think that if we talk about the health workers crisis, which is huge and is going to become ever bigger, we need to go a little bit out of the usual scheme of let's train more, let's retain more. Fundamental, they must be done. We need to continue training, but if you look at the numbers in terms of the future demand, just linked to an aged populations, and the speed at which we have the aging of the populations, if we continue to train more, which has been done actually in European countries, well, the divergence between the trends on the demands linked to aging populations and our ability to train more doctors, nurses, and so forth is just going bigger. So in a way, we are finding ourselves in a situation because the populations are aging themselves, the pool of people we can recruit health professionals for is decreasing. The competition from other sectors for talents is going up. We probably need to think of a different model. We need to think of ways to improve productivity of the health professions. We need to think of a way in which we can integrate digitalizations and technologies in a way that help making the job of the workers, of the health workers, more productive, devoting more time to care as opposed to administrative jobs and others, but making sure they can really attend to those who are most in need. So we need in a way to think differently at the production function, and not just thinking we're just solve the issues by training more, because there is obviously an issue about mobility of health professionals from Eastern to Western European countries, but there are also broader global issues about us recruiting from low middle-income countries.
Thank you for sharing this. And I think what was very interesting that was touched upon also during the opening remarks is how to move the systems from reactive to actually switching to preventative care. And I know that, Caroline, you wanted to bring some points here, and could you please share why is it important with aging populations, with more people to treat, how this shift would help?
Yes, indeed. Well, first of all, I would like to say that the problem is not an aging population. The problem is that our aging population is not aging healthily. And we see that more and more chronic diseases are now emerging at earlier age than it was before. So that needs to be addressed, and that can best be addressed indeed by more preventative services and more investment in health promotion and disease prevention. There's plenty of evidence out there, as you also said, that it's cost effective, and there's also evidence that health promotion, even at an old age, 80 plus, makes sense and works and is effective. So we need to look into new ways for our health systems, and I think the only way forward is to move towards more community-based health services, boosting primary health care, making links between primary health care and other sectors. One really nice example to do this is social prescribing. Social prescribing is that doctors that are confronted with people with problems that are not medical but maybe more social problems, for example, loneliness is a growing issue, that he or she addresses the patient to a link worker, and the link worker knows exactly what the assets are in the community, what are the activities that this particular person can help. So that is, I think, a vision for the future that we would need to build together.
Absolutely. So basically, in the end, it's about living healthy life. And I think where the issue comes is that it's not only in the hands of health minister then to ensure this. It's really cross-sectoral. So I would like to bring in Simon Brassel here, and maybe you can share how can we demonstrate the long-term economic value on investing in preventative care so we can actually ensure that other ministers and other policymakers are on this task too.
Yeah, I think like there, I think we have to enable basically policymakers who want to increase the health budget to make an investment case to those who control these budgets. And they have all like a range of questions that they will ask. Is the health spending currently optimal or below or above the optimal level? Is there spending that we can I spend my money somewhere else outside of the health system and achieve the same effects, for example, on health actually, because we can improve the social determinants of health? Is it spent efficiently and effectively in the health system as well? And then are there spillover effects on other parts of the economy? And will we just extend life, or will we actually also increase healthy life expectancy? And I think these questions, basically, decision makers who want to argue for an investment into health, we have to enable them with the right tools, data, and evidence, and this can be cost-benefit analysis, fiscal health modeling, and so on, to make this case, actually, that health is an investment. We hear this, we heard this all before, right? That health is not a cost, but it should be an investment. And I think like these tools and these tools box is really, really important to put out there and then use it. And I think like the Observatory of European Health Systems issued a fantastic report actually this year on that maps exactly like these challenges and these toolboxes together.
I love hearing that actually spending money on health is an investment. So basically, based on Eurostat data, what I saw that Germany is one of the countries that has the highest healthcare expenditure relative to GDP. In 2022, Lithuania, in the meantime, had twice lower one. However, on the bright side, the healthcare expenditure per inhabitant between 2014 and 2022 doubled in this Baltic country. So I would like to ask Health Minister, how is it going to fight for health budgets, especially when we're getting squeezed? We see what's the geopolitical situation. It's not easy. The priorities, political priorities are shifting. I think there's also issue with short political terms that also might not work in the favor of health budgets. So how is it going in Lithuania? What's the fight there?
Yeah, actually, the short terms of a political cycle was one of the thoughts I was thinking when colleagues were bringing the topic of investment as a strategic investment to the healthcare. Because yes, for sure, especially in the countries who has a shorter how to say, history of the democracy, right? The post-Soviet wing has still, at least in Lithuania, we still have that swinging political life, let's say it like that. And every political party comes in and tries to, at least to change something from what has been done for the last 4 years. And for that instance, it is very hard to keep the strategic aim to one direction. We are starting to achieve that, but still it is quite hard to achieve. And in that sense, it is the same when we are talking about the money. Good thing that in Lithuania, our healthcare budget, which we are spending for the service provision, is linked to the general growth of GDP. So now we are quite we are growing. We are nicely growing together with the economy. And for example, for next year, our budget is increasing like 15%. But that budget is going to the services. And when we are talking about the prevention, it is the gap in Lithuania because prevention mostly is delivered through public public services, and that is another budget, and we are talking about state budget. And if you want to fight for a part in the state budget with other priorities like defense, like pensions, like, you name it, it is really hard to stand out. And in that sense, we stay in the position that we can increase the salaries for doctors in the last 4 years by 80%. We can increase the salaries for nurses by 60%, but unfortunately, we cannot, with that system, invest enough for prevention. Of course, we are covering immunization, we are covering other bits, but not, community services. Of course, we are talking about how to connect the community services together with the primary care, but also, these bits falls under the difficult decisions in the short political cycle.
Thank you. Mr. Balzan, we just heard how important is preventative care. So I'm wondering, how can doctors' community be encouraged and supported to focus more on preventative care, especially when we hear that maybe there is not enough budget on that side?
So I just want to give some examples from my practice. Perfect. So the most common referral nowadays in pulmonology is sleep apnea, which is clearly related to obesity. My second high demand is people who have been smoking all their lives, who nowadays don't die young because every one of them have a 24-hour oxygen machine and a ventilator at night. So they live much longer. So, and then the third common disease is bronchial asthma. If we had clean air environment, the patients might still get asthma, but they wouldn't be that sick. So this is environment. So these are things which can be acting upon to decrease load, but you cannot change the time back. Now, coming back to solutions for the doctors, I take up your suggestion that we want IT systems to be doctor-friendly. I will give 2 examples. I log into my computer. I need to put 3 passwords in 3 different systems. Then I see the patient, I examine him, and I come back to the computer to write my note. The computer logs me out, because some IT specialist thinks it saves money if they lock you out after 10 minutes or 15 minutes. So that wastes time. So the IT system must let the doctor do what he is best at, diagnose and treat. And the people who design IT systems must utilize the doctor's time to do what he does best. I can't waste 1/3 of my time logging in, logging out, finding this, finding that. So, like everything, there are good IT systems and bad IT systems. And I think this is one of the potentially modifiable factors in making our work more efficient for us and for the patients.
Perfect. We will touch a bit more on this IT potential that it holds. Just a quick question for the Minister. How useful are EU funds for healthcare systems in Lithuania? So, I mean, we all heard that there was a big part of the cut. I don't think it's felt, but basically even for digitalization, for building EHDS, there's a lot of millions put aside for that. So are you using those?
Yes, we are.
Perfect. Actually, if you don't want, you don't have to, or you want to elaborate more?
No. I mean,
okay.
These investments are really important. Actually, when we talking about whole budget, well, money which comes from EU maybe is not the majority of what we use in our healthcare system, but it is really important, and especially when we are talking about digitalization, really a lot of millions are going to that system. So that means it helps us to make the system more efficient, makes our system to use more data, to move to a secondary data use and so on, and get to all the personal medicine stuff and other highlighted keywords in this area. So we are really happy, and it is very, very important, especially in my initial speech. I mentioned that second topic I want to bring is preparedness for the system. Even so, investments from the EU is a very big part of them are going also to our preparation of our system. We are talking about trauma centers, emergency, intensive care, infectious diseases, hospital, and so on. And they are really important. And I hope and I think that in the future we should also continue thinking in that sense, especially in the defense area. We know that in European Commission we have a new portfolio for defense and space, right? So when we are talking about preparedness of the healthcare systems, we should also bring these topics together. For example, WHO manifesto states that we are talking about national health security. We are talking, and I think we should definitely bring these topics together when we are talking about the investments for the better future.
Mm-hmm. Thanks. Caroline Costongs, what are your thoughts on EU health funds, and how do you see them working in practice, actually, and also do they help for your organization as well?
Yes, I think, as the Minister said, the Recovery and Resilience Facility has indeed made a lot of budgets available for Member States. About 18 billion went into health, but not necessarily into prevention and health promotion, unfortunately. The EU for Health program, in that sense, was better, more important to us, in particular if you do not look at disease systems, but healthcare systems for health. You look at joint actions in particular. The joint action prevent NCDs, that's 96 million euros that goes into NCDs prevention by Member States, 110 million joint action on cancer, the joint action on Jakarta is also on NCDs, which is great. It's only very unfortunate that NGOs and civil society and some other organizations are not able to participate in these joint actions. So we are missing out on all of that money. There are action grants, but as you can imagine, they are much less. And if you particularly look at the operating grants for health NGOs, it's tiny, it's peanuts. It's only 9 million for several organizations for 1 year, which is, I think, a mismatch and a missed opportunity also for generally health systems in Europe. I'm also worried when we look at the second multi-annual framework, financial framework, because there are proposals now for the new funds post-2027 is to have the funds in, so let's say, 3 pillars. So one pillar are national grants for member states, with some targets, but I'm thinking how can we be part of that? How can Parliament have a say on that? These funds are on health and social issues as well. Then the second pillar is one competitiveness fund. So the EU for Health program and all these programs will be part of this big competitiveness fund. And the third is more for external action and crisis. So this is a completely different architecture, and we are quite concerned to see whether it is not all going with this big competitiveness focus, but that there still is an equal balance into health promotion, prevention, social factors, and so on. So we have a very looking at the future program.
I would like to bring in Francesca Colombo here. What are you hearing? How does it resonate for you?
In terms of, well, I can't comment on the EU funding for health. I mean, for me, there is, however, something that we must be a little bit more ourselves, because in a way in these meetings we all agree, and we pitch to the converted. We all agree we need to invest more in health, we need to have more for a health workforce, and and we say that was the OECD, but we never really talk about the fact that looking at the future, the financial sustainability of health system will be a big issue. The trends in growth in health spending will continue to go at faster rates than the ability to generate revenues from governments and that growth. And so we must also think at transformative changes in the health system. We must go back to the issues of where we can cut waste in health systems, and there is, unfortunately there is. And that's what also Ministry of Finance wants to see. I mean, they say, on the one hand, we don't really understand well health, because people can't talk about daily quality and so forth, they don't really understand. But on the other hand, it's always asking for more and never demonstrating the kind of strategic changes which are made to improve the efficiency, the value for money, and so forth. And that is important for Ministry of Finance, but it's also important for the long-term financial sustainability of the system. So I think we need to do more in that space as well, and it's going to be fundamental if we want to free up the fiscal space for the investments which are needed. Even digitalization, we all agree that that's a potential transformative change, but we cannot just think of having health systems which were conceived in the pre-digital age and just plug on it some digital technologies. It will not work. To really have those improvement in productivity and in value and in outcomes, we need to think differently how also the systems that we have, the health workforce and so forth, interact with the digital. Mm-hmm. So we need to be a little bit more disruptive ourselves, I think.
Mm-hmm. Thank you for sharing this. I also remember the release from your organization that came recently on AI in healthcare, and what was very clearly stated there is that AI shouldn't be another burden for doctors and healthcare professionals, but it actually needs to be a simple and easy to use additional tool rather than extra work to do. We're kind of running out of time, but I would love to ask Simon Brassel, what do you see, how can technological innovation support healthcare systems, and do you see that it could reduce the costs?
Good question. Before I was a health economist, I was an electrical engineer, so I generally love med tech and tech in health. But I also know from personal experience it's quite hard. It's a quite regulated environment, so this whole sentiment of big tech, move fast and break things doesn't really work in healthcare, and it shouldn't maybe work in healthcare. Like, I mean, we want devices that are safe and so on. But I think like there's so much. We just heard an example how common IT systems, I think, that we outside of the health system are very used to. They work very well, they are fast and so on. But in healthcare, I think like you cannot really like wait until computers basically start up, like, you know, still 8 minutes or something in the NHS. It's just too long. And I think there's a lot of basic infrastructure that needs to be basically renewed. Then we can think about what digital technologies are already available, and I think there's a lot potential in telemedicine, digital health, and so on. And then we come to the whole AI buzzword that has really great potential, but also really huge risks. So I think like big potential for technology to increase the productivity, but not always as easy and as flashy maybe as we all think it might be at the moment.
Thank you so much. Thank you for all the speakers. I think what's clear that it's not an easy recipe. However, there is a need for paradigm shift in how we see health, moving from reaction to actually focusing on preventative care. And also, there's a great point that we have to make the systems more efficient and see where we can do cuts without actually, I mean, it would be great to get more budgets, but it might be hard. So how do we work with the money that we have? Thank you so much. I would love to ask for a round of applause for our speakers. And I would invite you not to go anywhere and stay for the following session on cancer healthcare system readiness. And it will be presented by Cristina Gonzalez, Executive Vice President at POLITICO. Thanks. Thank you.